first disease we are going to look at is contagious caprine pneumonia, or CCPP. This is a disease which affects the respiratory system of the goat, and it's a dangerous disease, as you see. The incubation period of the disease is 20 to 30 days, and what that means is from the day of infection to the day the first sign will be seen, will be evident, that it takes 20 to 30 days. And this disease, you realize that some of the goats die even before showing the sign. Severe infection occurs and the goat coughs, because we said this is a disease that affects the respiratory system, which is the lungs, the bronchus, and other parts. The goat coughs and have a discharge from the nose. The other sign that is evident is that the animal may die before showing the sign, as we had said earlier, and there's a difficulty in breathing because the lungs are full of fluids, so the animal struggles to breathe. The animal has high fever, increase in temperatures, which can go even to 41 degrees from the normal, that's 7.5. So high fever. The animal looks tired, fatigued, because we said it's a respiratory infected disease. So there's no enough oxygen the animal is getting. So the animal is tired. There is diarrhea as a symptom. Then the animal looks weak because of the diarrhea. Diarrhea comes with dehydration. So the animal is dehydrated, the animal looks weak, and death occurs in 4 to 5 days. That's how bad the disease is. Now, how does the disease is transmitted from one goat to the other? So it's the bacteria that causes the CCPP is transmitted from one goat to the other by sneezing, coughing, and it infects other goats. How do you treat this? It is a bacteria, so we use an antibiotics to inject, like a product like tylosin. We inject to the goat to kill the bacteria. Now, how do you prevent? You vaccinate against the bacteria, and to the affected animals, to prevent transmitting to other animals, you do what? You remove the animals from the herd. To prevent introducing the bacteria to the herd, if a farmer is buying or getting a goat elsewhere, it is important to vaccinate the animal before introducing it to the herd. And even before that, before introducing directly, it is important to seclude the new goat for some time to look at it, then introducing it to the new herd to prevent it bringing a disease like this to the flock. The next disease we are going to look at is mastitis. Mastitis is a bacterial disease, and it affects the udder. How will a farmer know that the animal is suffering from mastitis? The most important sign is milk has the clots and it's watery. This is what we call prognosis sign. This is what tells that it is not another disease, but it is the mastitis. But the other symptoms, one is fever, increase in temperatures, 40 degrees centigrade. We have toxemia. For toxemia, this one has to be tested. This is toxins or poisons in the blood, toxemia. The other one is lameness on one side of the udder. of the udder. Remember, the udder is affected already, so there is lameness of one side of the udder. There is swelling and gurglings. If you touch, you feel some sort of balls in the udder. So those are the gurglings. So, and the udder is swelled and hot. Udder becomes hot, and if you touch, you see the goat kicking you. So it shows that it's painful. These are by seeing these particular symptoms, this tells you that the goat is suffering from mastitis. But the most important, as we said, this is one. How do you know this? We have what we call strip cup. We have strip cup. Strip cup is where you press the milk. It has some seals. You press the teat. You squeeze the teat. Then you see some clots, and that one tells you that the animal is already suffering from mastitis. Now, how do you treat once you see such symptoms? The first treatment mechanism is you make sure that you milk twice per day, at least to reduce the population of the bacteria within the udder. And also you massage the udder. You can also administer antibiotics. Now, for administration of antibiotics, this can be done by a veterinary via the teeth. You have the teeth. You just administer the antibiotics directly through the teeth. This is one of the way. The other one is injecting. You can inject antibiotics. If the case is serious, you do inject using antibiotics. This is you completely heal the animal from the mastitis. But this disease is bad because once the animal is affected, the production goes down and might even not recover from this. Now we look at the prevention. How do you prevent this one from either spreading or even attacking your animal? The first thing is you make sure you completely finish the milk from the udder. When milking, make sure everything has been removed. The other one is you clean the udder. You clean the udder. The other way you can also prevent your animal from mastitis is make sure the milking parlor is well cleaned. That's the hygiene part. You can also dip the teeth. The teeth, you dip them in what we call iodine solution, and this one also will assist in preventing the disease from attacking your animal. Now, to the affected animal must always be milked last, because this bacteria can be transmitted through the hands of the milker or even the equipments that are being used. So the affected animal must always be milked at the last to make sure that you do not spread the disease to the rest of the herd.